Welcome back. In today's video, we're going to discuss the top 5 mistakes that patients make with regards to their health care. The first mistake is not asking questions or speaking up if something doesn't sound correct. Many patients will stay silent. They don't ask doctors questions or challenge unclear information. This matters because it can lead to misunderstanding. You leave there not fully knowing what the doctor said. You might make an assumption about what was said in that visit. It may lead to a preventable error. Patients who don't fully understand their diagnosis or treatment are less likely to follow through. In fact, I've had this happen with my patients. I've recommended a particular treatment. The patient didn't ask clarifying questions, relied on information off the internet or through friends, and then didn't follow through on the treatment. When they come back with the same problem or the same complaint, and I ask thinking that the treatment wasn't working, they then tell me that they never started it because they weren't really clear about why they were going to use it. So how do we fix that? Well, you should be encouraged to prepare questions before appointments. I've talked about this before. Go into the appointment with the information or questions that you may need addressed. I also ask my patients to repeat back to me in their own words what they thought I said during the visit. I'll ask the patients, tell me what you think you heard me say today. Tell me what you think the medications I'm prescribing are going to help you with, and what are the expected outcomes. Good doctors are going to embrace questions. They are going to be happy that you've asked questions. If your doctor seems annoyed or put off by the fact that you as a lay person are asking questions, well, that's a red flag. You need to find another doctor. The second mistake that patients make is not keeping track of their own health information. I think I've talked about this before, but the EMRs, the electronic medical records, don't interface. So if you have tests done in one facility, the new facility may not know that those were actually performed. And what that leads to is duplication of testing, inappropriate testing, and can often lead to confusing information that may be harmful. So it's really important for you as your own advocate to say, I have these records from X hospital or X doctor. Would you like to review them to make sure that things you're offering me or discussing with me, medications you want to start, aren't going to interfere negatively? The other issue, a big one, is drug interactions. And again, if doctors aren't given all of the information, when we enter a new drug into our electronic medical record, we won't automatically get that drug interaction that we typically will see. So when I enter a new medication and I have a complete list of all the meds you're taking, I immediately get drug interaction information. And then that will prevent harm by me knowing that, oh no, I should not give this medication. In fact, I had a patient again this week who was on a medication that wasn't on his med list. I've been seeing him for chronic issues with bleeding from his bladder, and come to find out this medication was a high-dose fish oil, which worsens bleeding because it thins your blood. So this man was not only on a blood thinner, but he was on high-dose fish oil, both of which contribute to spontaneous bleeding. So once this was recognized, we discontinued the fish oil and his bleeding has resolved. So I asked my patients, either keep a handwritten folder with results of testing, lab results, doctor's notes, or sign up for the app with each of your healthcare providers. So if you see a doctor at X hospital and another doctor at Y hospital, sign up for their portals so that you can then share that information when you go to any doctor anywhere. It's also critical because if you get hospitalized emergently in an outside hospital, they can't necessarily access your health information, but you can, or your family member can show them, these are the things that are wrong with my loved one. These are the medications they take. You have a legal right to obtain your notes and x-ray results and lab results. That's your health information. So if anybody again says, oh, I can't release that to you, or no, we can't tell you about that, that's not legal. And that's really important to have those records. So the third mistake that patients make is that they stop a medication without consulting the provider, the doctor. Sometimes they stop the medication because they feel better. Other times they stop it because it's too costly or there were side effects. I've had situations where I've prescribed a medication, say for overactive bladder, patient's doing great, and they decide, well, I'm doing fabulous, I don't need this anymore. They return to the office and they tell me that their overactive bladder symptoms have recurred. Well, I'm making the assumption they're still on the medication, so my mind is already thinking, well, what's changed? Is there a new diagnosis that I'm missing? Do I need to increase the dose? What's going on? And then suddenly the patient tells me, well, I was doing great, so I stopped it. Well, that answers the question, but without letting me know that ahead of time, I'm not aware. The other reason that people stop medications, unfortunately, is because of the cost. It's important to talk to the doctors openly about your financial situation, ask for alternative medications, and again, as I've mentioned previously in the other videos, check the formulary of your insurance company so that you can say to the doctor, they really don't like the medication you gave me for my high blood pressure. This is the alternative that is covered. Is this a possible medication for me? Some people are just afraid to use the medication, but they won't express this to the doctor. I've had several instances recently where I've wanted women to use intravaginal estrogen, which is totally safe, no risk of malignancy, cancer. There's no harm from it, but unfortunately it still has a black box warning from a flawed study, and it has not been removed yet. But all the current literature over the past decade shows that this is an appropriate treatment to prevent urinary tract infections in women. So again, their fear, because of a black box warning or something they read on the internet, prevents them from using the medication. And when they come back with recurrent bladder infections, I'm thinking that they're breaking through the treatment when in fact they've never really started it. The real reason why it might matter is that you can't stop steroids, antidepressants, high blood pressure meds, cardiac meds abruptly without potentially having significant withdrawal, which in some cases can be life-threatening. So how do we fix this? You need to have an open conversation with the doctor about cost, the potential side effects that you may endure, and alternative treatments that are available. Have open and honest conversations with your doctor or healthcare provider about your fears, about the cost of the medication, about potential side effects, drug interactions. If your doctor does not want to have these conversations, or you're getting pushback when you ask these questions, then that's another red flag that perhaps this isn't the right patient-doctor relationship for you. The fourth mistake that patients make is they wait too long to seek help. Oftentimes patients won't report symptoms or come to follow-up visits or go through routine screenings. And reasons for that may be fear about hearing bad news, fear of what the test entails. Is it painful? What are the risks of it? Some people just deny that anything is going wrong and really don't want to face the truth. But putting things off delays treatment potentially and will worsen your outcome and long-term complications and potential survival. And we all have busy schedules, myself included. I've put off some routine screening that I've needed for far longer than I should have. We can't let our busy lives and our schedules get in the way of our health. So we've all heard early detection saves lives, and this is why it matters to address any new signs or symptoms. Maintain your routine surveillance tests like colonoscopy, mammography, pap smears. Make sure you stay on a fixed schedule for those types of screening tests. If you delay your care, all that happens is you may need more invasive treatment. You're definitely going to incur higher costs because The more treatment you need, the more money it's going to cost, and you potentially are going to have worse outcomes. And nothing is sadder to a doctor when a patient comes in with an advanced situation, clinical diagnosis, and we find out that you've been having these symptoms for months or years. It truly breaks our heart because we now know that if you had come in 6 months earlier, your prognosis, your long-term outcome would have been significantly different. So I encourage all of you to schedule your preventative visits and screening tests like I've talked about. Don't just go to the doctor when you have an urgent concern. Also, never think that a symptom is too small or that you're bothering the doctor or you'll be dismissed. Again, if that's how you feel in your current doctor-patient relationship, that is another red flag. You know your body better than anybody else. And again, it goes back to things I've talked about in the other videos, that the doctor needs to listen to the patient because 99% of the time, you will tell us what's wrong with you. If you notice any subtle change in your health, don't dismiss it. Don't think that it's not important. And if you can't get to a doctor's visit, ask if you can do a telehealth. It's covered by your insurance, and it gives you the opportunity to FaceTime with your doctor and discuss what's bothering you. And it's also better than a phone call because the doctor can actually see you and they can assess how you look, how you're acting. They get a lot of cues from that. So I always like telehealth visits with my patients rather than audio because I am interacting with that person on a social level and I can visualize how you're expressing things and your level of anxiety or fear about this new symptom. The fifth mistake is trusting unverified online information. And I jokingly call it Dr. Google because my patients will come in with information that they saw on the internet and they're concerned that what they read contradicts what I told them. Social media, your friends, Google are all experts in your mind, and that's fine. Everyone has an opinion, but when it comes to your health, information should be obtained from reliable sources. Your doctor, certain websites that are either government run or associated with reputable institutions, that's where you should go get your medical advice. Not from Reddit, not from TikTok, not from Instagram. Go look at the NIH website. Go look at the National Cancer Institute website. Look at Mayo Clinic or Cleveland Clinic. You know what I'm saying? You guys understand that go to these big institutions' websites, and that's where you should get your information. So anything basically that ends in .gov or .edu, those are usually reliable. And you can bring this online information to your doctor to have them review it with you, but just bring it from a reputable source. Don't print something off of Reddit and bring it to me and say, well, there was one person in some random place that wrote this online about their experience. You really need to educate yourself from reputable sites. So the biggest takeaway too that I want you to have from today's visit is remember that you are the owner of your body. Your health matters most importantly to you. I ask my patients to contact me if they have not heard from my office in a week and a half with their scheduled examinations or follow-up appointments. I always tell them, listen, you're one of one. I have 1,000 of you. You need to gently remind me that I forgot perhaps to order your exam or your lab test, or that my office hasn't gotten around to it yet. And any doctor's office or any doctor that gets upset about that, that's a red flag. I'm happy when my patients remind me because the last thing I want to do is forget about you. Forget about your test, forget about your follow-up visit. So I hope this video was very helpful today. I look forward to seeing you again. Please subscribe, please leave comments, And again, I'm open to topics.